Harris of California.
Thank you, Bernie. Well, I'm honored to stand with my colleagues and be in a room full of leaders. And this is a moment in time that I think we know is a very significant moment in time for our country, where we, all of us, are standing up and saying, let's just do what's right. You've heard so many folks talk about it because we know it. Listen, no baby is born in America born as a Democrat or a Republican. This should not be thought of as a partisan issue. It's not even a bipartisan issue. This is a nonpartisan issue. Cancer, diabetes, high blood pressure affects folks around our country regardless of whether they're in a red state or a blue state, regardless of their income, regardless of their status. And we should not differentiate in the way that we do public health policy. We should understand everyone, all, should receive the health care they need regardless of where they live, their income, or their zip code. And that's what this bill is about, and I am proud to co-sponsor it. It is about saying that this is about a right, not about a privilege for a few. And let's be clear, it is not only about what is the right thing to do morally and ethically. It's also smart in terms of the fiscal impact. Taxpayers will benefit. You know, our friends in the private sector, they talk about all the time. If they're asking about, are they being efficient, are they being effective? They ask that question with 3 letters. What is the ROI, return on the investment? Well, the taxpayers of the United States deserve a better return on their investment. And when you look at this situation, what we know, the public health model tells us so well. You want to deal with an epidemic? Smartest, most effective, and cheapest way to deal with it is prevention first. If we're dealing with it in terms of early intervention, and certainly if we're dealing with it in the emergency room, it's too late and it's too expensive. Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all. And why? Because Medicare for all stands for the proposition that all Americans from the day of birth throughout their lives will have access to health care. It means understanding that the data tells us somebody with high blood pressure, if they are receiving consistent care, information about what they should be eating, testing and monitoring their blood pressure, we know if we reduce that population who have high blood pressure by just 5%, taxpayers will benefit by $25 billion over the next 5 years. Better return on the investment. Let's look at it in terms of the emergency room. If people resort to the only care they can get in an emergency room, as opposed to monitoring on a daily basis, on a regular basis with a physician that they know and trust, we're looking at right now in the United States $35.7 billion a year in unpaid emergency room bills. It's a better return on the investment for the American taxpayer, and that is why I'm proud to stand with my colleagues and friends and support Medicare for All. Thank you.
Thank you.